So this is Amir Khan here uh, for Info 556 Spring 2018 individual project called Health Vault. So I'm going to show a demo of my project, quick demo of my project. So let me just start my IAS service and okay, so since I was debugging, it got open without any credentials. So this is Health Vault. This is the homepage of Health Vault. Health Vault is basically the personal health records system, which allows users to record their measurement, edit their measurement, record their symptoms, and uh, see the symptoms in reference with other symptoms, as well as there is a repository called Preventive Care Results, where user can search the repository in reference to their symptoms, as well as there is a family member record. The main objective of this project is to weave the measurement records of family members. So as I go further into the website, you'll get to know better what exactly uh, the project is about. So let me just first test the login page. So here I'm not going to type anything and just write login. Okay, so it says that some fields are required. I'm going to type anything. I'm going to type anything. So password is taken, but email is still not taken. So let me try to give @ and then type anything and then the .com, the format as it needs. And then it is like it has taken it. But this is not a valid one, but still we'll just try how it validates. And let's see whether, okay, so it's giving invalid login attempt. So let me now try a real credentials, which is already there in the database. That's my name, amirkhan@gmail.com. And let me try my password and password. And here I log in. So as soon as I log in, I'll land into my dashboard. So this is the dashboard page where I can see my records like my measurement, my symptoms, my insurance details, and family members. So here you can see like my father, the measurement details for my father I can see, and when it was recorded with the time and date stamp. But for my brother and for my sister, I cannot see. The records are blank. It is not because they have hidden or something, or there's some kind of privacy settings, but it's just that they are enrolled to a Health Vault, but they are not willing to enter their measurements even to Health Vault, because if they enter the measurement in Health Vault and this system in this website, automatically this data is auto shared with each family member. So that is why you can see the blank data here for my sister. And these are my measurements, which my father or my sister or my brother can also see, but they cannot edit. But I can edit my measurement, so let's edit the measurement. And here I go. Okay, so I have decreased a little bit of weight, so I'm gonna put 82 kgs. A little bit of iron has increased because my diet is good these days. Blood sugar has also decreased, and it is balanced. Blood pressure is as same as it is to be. So the record date you can see is like 10th May 2:26 p.m. but now it's 10th of May 3:35 p.m. So I'm gonna edit this so that it has a proper timestamp, and it's recorded, and it should be AM rather than PM. Oh, I'm so sorry. The updates are gonna come, but no, I'm not gonna show any updates at the moment. And I saved this record. And here you go. So I've saved the record by updating all my records on 10th of May 3:35 a.m. So here my father can see, or other of my family members can see my records, and they can see the recorded date and time. So maybe after 2 months, if they want to again see my records, they can log in into their Health Vault and they can see what my records is. And if I'm not updating anything since 2 months, they can just aware me. They can just intimidate me to update the latest records. And here are the symptoms. Suppose I'm feeling feverish, so I can record my symptoms. So I've already done that. And suppose I'm not feeling high temperature, but I'm feeling body pain. So uneasiness and body pain. So if I save this, it will take me to all the symptoms, which is already there in the Health Vault, and it is like I can take these symptoms as a reference. But yes, if I go to my own dashboard, so here you can see the symptoms, which is mine, and I'm like like some easiness and body pain and feverish I'm feeling at the moment. And there's my insurance with the start date and the end date and the emergency contact, which also can be edited. And that's my family members data, which I can just weave and cannot edit. So let me go to preventive care standards. So here, this is the repository which I was talking about. This repository is with the procedures and the storage frequency, minimum, maximum threshold values, and the name of the disease. So these values can also be edited, deleted, and the best part is that these values can be searched by the procedure name. So suppose I want to improve my diet, so let me see if there is any procedure related to diet, and I search, and here I get diet therapy. So the storage is 20, you can do like 60 times in the frequency, and some kind of disease is also related with that. Okay, if the disease is not right, I can just edit it, like, okay, so it can take from the list of stored diseases, and suppose I'm taking this as a weight loss. So minimum value, you can say that you can opt for this diet therapy when you are minimum at least 60 kg, and maximum you are maybe 120, no, I'm sorry, 100 kgs, yeah. So that makes sense. And I'm saving it. So this is what it is saying now. So diet therapy for weight loss, minimum and maximum values, and start age, like recommended 20 in the frequency. So likewise, all these repository can be searched. And then suppose if I have mosquito bite, so what I can do with that? So I can use mosquito repellents. It's like the threshold value and minimum value, like the mLs or the sprays which I can use on me is this. And suppose if I'm like not searching anything and I just give a search here, so it will return me all the values in the repository. And the best part is that I can also see the details, and then if I go back to the list, I can also delete. It will ask me for the confirmation, and if I give the confirmation, it is deleted. Now let me go back to my dashboard, and suppose I want to see my family members data and my brother is not even enrolled, like one of my brothers enrolled, the other brother I have is not enrolled. So I'll ask him to enroll, like I'll enroll as a demo for him who is in hometown, so that the data, the measurements which he's willing to store in Health World in the system is reflected to my dashboard. And he's not linked to my family, so I have to link him as well. So let's log off and enroll him for Health World. So let me just fill in some details, and my brother deals I'm filling in. So imran@gmail.com, and contact number. Oh, he's in India, so I'm giving an Indian contact number and password. Okay, suppose he's typing 2-character passwords at the moment, and he's trying to register. Okay, so it is validating the registration page that it should be at least 6 characters long. I'm just typing random, like different passwords in different fields, and again, it's validating that it should be matching as well. So let's type real passwords, and here you go. And register. Boom. So let's log in to see whether he is registered. And oh, I'm sorry, it's like imran@gmail.com, and his password, and a login. So here you can see since he's a new user, so there's no records, there's no family members as well, because he's not associated to any of the families yet. And let me just create his record. So suppose he's willing to store his record into Health World. So now what it happens? So suppose he's having height of 60 inch and weight of 65, iron levels of 45, blood sugar levels of 90, blood pressure of 120, and the dates are like 5, 9, 2018, and the time is like 3:42 at the moment. So time is 3:42, and let it be any seconds AM. So let me just create this record. Oops, I'm getting some error, it looks like. Oh, okay, so I've set it to debug. Let me just continue. And here you go. So this is the record created on, I'm sorry, I put a wrong date, but any which ways, let's edit this. So it is like 10th of May rather than 9th of May. And here, save it again. So yeah, so this is of 10th of May, 3:42 a.m. He's recorded his measurements, and he's a new user, but he's not associated to any of the family family members or any of the families inside the database. So I've not made a functionality to add the members to the family from the front end, but yes, I'm gonna associate him in the back end. So let me see the patient data. He's not reflected yet. I have to refresh the patient data. Okay, let me refresh. It's refreshed. Now let me see if he's reflected. Okay, so here you go. So here's my brother who has just enrolled to Health Vault, and you can see the ID, the family ID of my brother is null at the moment, and my family ID, that's Amir Khan, is 1. So let me make the family ID same as mine. So he is now my family. Okay, so he's now my family, and let's log in. If I log off from his record, and let's see if the records which he has kept, I can see them or not. So let me just log in, and okay, so let me just log in, and what's my password? Okay, so my password, and here to login. Okay, so here you go. So here is Imran Khan, my brother, who I asked just to use Hello World and update his latest measurements. So he did it on 10th of May with all his basic measurements. So these measurements are basically enforced measurements. If you're using Health World and if you're inserting these measurements, it's auto-shared between family members. So these family members are not willing to even store their measurements into Health World. If they're willing to store their health measurements, then yes, by auto, it will be shared to each of the family members until unless they are not out of the family. And if they're out of the family, definitely there will be no members at all associated with them, not to even read the data. So this was Health Vault. Thank you.